Peter Terziak. Great state Thank you very much. Thank you. This is important. Connecticut's done well with health care. Connecticut's done well with health care. Yeah. We've been a model for the nation. Let me mention just one way. When we said parents will be able to keep their kid on their health insurance until they're 26 years old. It was supposed to be the end of industry. Turn off the lights. It's never going to happen. It's one of the two most popular parts of Obamacare. It's the one thing that every enemy of Obamacare says they want to change. We've been right about this. We're right now. Healthcare is a right. We can do well. We're out here protesting that 22, 3, 4 million people might lose their health care. Don't forget, that was as well as we could do it. Left 30 million people still without health care in America. That's the direction we need to be going for. Health care for everybody.
Has been representing healthcare as her specialty. She's going to lay it on you.
Okay, go later. All right, Terry. What a wonderful rally. I'm so glad that you're all here. It's so very important as the people in Washington go through and navigate whatever sort of plan. And by the way, they have no plan, in my opinion, at all. You know, Peter's right. Healthcare is a human right. It is essential. Absolutely essential in this country, and by the way, everywhere else in the world, every country recognizes healthcare as a human right, except for this country for some reason, or at least a small portion, I should say, certainly in the minority. You know, if you look at the facts, if you look at the statistics, almost 60% of Americans are totally against any changes that are, or I should say the government in Washington, D.C. is proposing. Almost 60%, and that number is growing. I just want to take a minute to talk a little bit about Medicaid. Medicaid, you know, Bill has Zoe will lose care under the proposal that is coming down from our federal government. This is a crime. Someone like Zoe, who is a very young woman and is able to stay at home with her parents, will lose essential components of Medicaid that help cover her and keep her in her home with her parents. Are we going to go back to an age where people are put into institutions? No. No. Are we going to go back to an age where people did not have health care, got sick, and ended up in the hospital or an institution? No. That's not the direction we want to go in. And our message to Washington is they should not either. This is an essential, and I believe, humane right here in our country. Health care for all, I remember campaigning on that all of my political career. Health care for everyone. We thought we had it done with the Affordable Care Act. And some of those components that Peter talked about, coverage for children up to 26 years of old under their parents' plan, no pre-existing conditions, those are all at risk. This means more and more people without health care, no matter how you look at it, more and more people who won't get health care, and as God is my judge, they will end up, many of them, or some of them, with no health care and no life. This is of deep concern to us all. So rallying here today, this is wonderful. We are standing up for the right message. We are standing up for the right policy. We are standing up for the people in our state and in our country. Thank you.
The Affordable Care Act, some people call it Obamacare, a step in the right direction. We're going to keep going. We're certainly not going to take a step back. And another step in that direction is to elect Merrill Gay, the next mayor of New Britain. So, I'm here not
really as a candidate, I'm here to talk about this because this is really personal for me. It's personal on 3 levels. I have a mother who's 83. She's healthy now, but if she were to fall and break a hip or something, end up in a nursing home, she could go through her savings and end up on Medicare, Medicaid. This bill is, all the bills that the Republicans are considering are bad for Medicaid. The next level, I have a daughter who's 25. She turns 26 next year. She'll have to get her own health insurance. She works at a coffee shop. They don't offer health insurance there. She'll have to buy it on the individual market. Will she be able to afford it? Will there be any subsidies? We don't know that from what they're proposing because they've been doing this all in secret. And then finally, at a very personal level, at my level, when I was about her age, I discovered I had a pre-existing condition. I have a chronic kidney defect that I was born with. And I take medicine that has kept me healthy since then, but that's my primary use of the medical system is for that condition. And if I then had to go out and buy health insurance, if I lost my job or decided to become a consultant or do something like that, I would end up under the various different things the Republicans are talking about, either having to pay for expensive health insurance on my own that wouldn't cover my pre-existing condition, or getting put into some kind of high-risk pool that would cost a fortune. I don't know. But all of the plans that the Republicans are talking about are pretty awful. I mean, even Donald Trump, somebody who I never agree with, called the House Republican version mean. It was mean because it was going to cut 23 million people off of health care. Now the Senate is trying to rush through something this week, which is why we're having this rally today. Their plan, well, the last time that the Congressional Budget Office looked at it, they said it was going to take out, well, 22 million, so a slight step in the right direction, but come on, all of this is awful.
It is awful.
You have to wonder, why are they trying to push this awful thing? Well, that's simple. This is all about giving the super rich an enormous tax break.
Right.
I mean, we're literally talking about taking from the poor and the sick to give to the super rich. That makes no sense. I want to know, is that something that you could stand for?
No.
And are not speaking up like Peter and Terry just did. We need all of our elected representatives, including one down the street, to speak up. I mean, the Republicans in Congress don't seem to care what Democrats say, so it's time for Republicans to speak up. So I want to urge all of you to talk to all of your elected officials, including one down the street, to speak up and say where they stand on this. We need all of our elected officials to speak up and say we won't stand for a plan that's going to throw 23 million people off of health care. I mean, it's 200,000 people in Connecticut who got health care through the Medicaid expansion. That includes thousands of people here in New Britain. Think about what are some of our bigger employers? We have a hospital up there and a hospital for special care. They both rely on Medicaid payments. They would be in really hard times if they didn't have those Medicaid payments. And the Republican plan is all about block granting those and controlling the costs. In other words, not providing services to lots of people who need it. We need to speak up. And I want to urge all of you to call your legislators, call elected officials, and urge them to take a stand on this.
To speak here today. My name is John Blankley, and I'm running for the state treasurer's job in the election next year. But I just want to tell you, you can probably tell from the way I speak where I come from. It's the UK, and in the UK we have a single-payer healthcare system.
Yeah.
It is a mark of what is a civilized society.
Correct.
Exactly.
That's what we have.
single most effective way to ensure, just lost my place, that legislation, like the ACA continues, is to support legislators that support that kind of legislation. And the single greatest thing that you can do to ensure that we have legislators at the federal level and at the state level is to attach yourself to the municipal candidates that are up for election now. If everybody can do one thing, if everybody can give 2 hours a week to these candidates, we're going to keep our state blue, we're going to keep our country blue. There are about 2,500 hours between now and the municipal elections, and we're hoping that you guys will provide 50 hours. It's a small ask with a big return. The Republicans have one big advantage over us. They have a lot of money. But you know what we have? We have a lot more people. And that's right. And if we all pitch in, we can out-manpower them. And that's how we protect legislation like the ACA. So that's my message to you. Everybody get busy and everybody stay active.
Yeah,
Thank you all.
I'm here to talk about something personal to me, which is healthcare. Now, I come at it from a more academic, because I'm in college, so, you know, bear with me on this. I'm a philosophy major. So, I'm going to start off with a quote from Cuba.
That's a good thing.
Thank you. So, almost every other developed nation in the world has some form of universal health care. So when people hear the idea and say, oh, you want a magical utopia where gumdrop kittens, you know...
Yeah, a little louder. We're interested in what you have to say.
Thank you. So, almost every other developed nation in the world has some form of universal health care. So when people hear the idea and they say, oh, you want a magical utopia where kittens should poop out money, like, that's ridiculous. No, I'm talking about Canada, as mentioned before. Noam Chomsky has a quote right here, where he says, in a Canadian-style insurance system, the costs are distributed in the same way taxes are. If the tax system is progressive, that is, if the rich people pay a higher percentage of their incomes in taxes, which other industrial societies assume correctly to be the only ethical approach, then the wealthy will also pay more healthcare costs. So why do I say this? Because there's a model, like there's tons of models we can use, which we could look at, and which are effective. But when the Republicans say and act like this is somehow crazy, that we're freeloading, as some people have even here suggested, that asking for basic human rights is somehow freeloading. That we're not. It's not that. It's very simple. We're looking at just anything beyond our borders, and you can find perfectly valid systems. But we're not asking for handouts.
Murphy, she got a message for you.
Not happy, but like, can I get a little bit of enthusiasm? So Senator Murphy wishes that he could be here today. He had to fly back to DC to vote in the Senate. We'll see where that goes. The Capitol right now is a hot mess, my words. It's like a disaster. Thank God we have a great delegation representing us from the top to the bottom, so we're very lucky. But I do want to encourage you all, Senator Murphy has on his website a testimony page on www.murphy.senate.gov where you can submit your healthcare testimonies on how the ACA has either saved your life or a loved one's life or impacted you in a positive way, and how this new healthcare is going to be detrimental for you and your family. So I encourage you to go to www.murphy.senate.gov, and the link is on our website. And if you have any questions, I'm here. I'm from New Britain, and you'll see me a lot. But thank you.